If you recently heard RFK talk about antidepressants and that concerns you because you're on these medications or you're thinking about getting on these medications, please stop, ignore what he's saying, because you need to talk to the people that actually take care of patients like myself. I'm internal med doc, and I can count, hundreds, perhaps thousands of times I've treated patients with mental health conditions that utilize these types of medications. Let me give you some real clinical insight into why the way he's talking about it is so extremely dangerous and potentially harmful. First of all, there's hundreds of thousands of people that take these types of medications and are doing perfectly fine and living very normal, fruitful lives, okay? There's that whole group of people. But inevitably, even in my own practice, there are patients that stop the medications. And why do they stop it? Well, maybe they heard some crazy pseudoscientific influencer on social media talk about these dangers. They hear RFK talk about this in a very vague, nonsensical way. Or they decide, you know what, it's just time, I want to get off of it. Or perhaps they have some side effects. For whatever reason, they stop it. And it doesn't work out well when they stop it without consultation with me, because these are a few things that happen. First of all, there's a few people that stop it and there's no issues. Great. They might have been on a low dose, they're doing well, no issues. But many people, when they stop these medications, have withdrawal symptoms. And that matters because it's the type of medicine, it's the dose of the medicine. All these factors play into the decision-making of how to get off a medicine. And worst of all, there are people who stop these medications who inevitably have the same symptoms that we were initially trying to treat. The anxiety, the depression, all those things start to come back. Their quality of life gets ruined, right? So that's why it's really important to do this in consultation with your physician. And this also highlights why it is so important to have medically trained people, doctors, those types of people run agencies like the HHS, the CDC, those types of organizations, and not make broad sweeping statements like RFK is doing, which is so dangerous because people are going to hear this and they're just going to stop the medication cold turkey and all sorts of bad things might happen. So once again, the way RFK is addressing this issue, talking about it with context to what happened in Minneapolis, is extremely dangerous. Ignore him. Talk to the people that take care of you. It is becoming more and more apparent with every statement he's making, every issue that comes up, every situation he's having to deal with, that he is completely unfit for this job.